So you finally got in with a dermatologist, you have all these questions and concerns and just can't wait to be seen, but how do you best prepare for your first visit with a dermatologist? Are you going in for a skin check? Are you going for aesthetic concerns? If I had a magic wand and could get patients to do just one thing before a dermatology appointment, what would it be? Hi guys, I'm Dr. Weinstein. I'm a board certified dermatologist, and today I'm going to share 5 things that I wish patients would know before their dermatology appointment to maximize that short time that we have together. Make sure you tune in. So this video is inspired by a podcast that I recently recorded with Dr. Jenny Liu, and we were talking about how important it is for patients to come prepared to their first dermatology visit. And there are a few things that you might not even think about that are just so important, will help with the ease of the visit and make sure that you get the most out of it. Number 1, so often patients come in to see the dermatologist for a concern. Maybe there was a spot, a rash, just something that was really bugging them. They called to make an appointment, and by the time they get into the appointment, it's gone. This happens all the time. Call it Murphy's Law or whatever you want. But if you have a rash on your skin or a spot that's changing or growing or itching or something that's really bothering you, it's important to take a picture and perhaps document the progression of the condition so that by the time you come into your dermatologist appointment, we can see what it looked like when it started and how it's evolved, progressed, or even gone away. Having pictures of your rash is a great way to help us as dermatologists help you so that we can have a better idea of how it started and what to do about it and to make sure that it doesn't come back. Okay, so number 1, take a picture of your rash. If you're coming in for a spot on the face or a rash that you've developed, take a picture. Number 2, when you come in, make sure that you have a clean face. And what I mean by that is if you're coming in for a skin check or an aesthetic assessment, the last thing you want is nurses wiping all the makeup off of your face with alcohol swabs. That's usually what we use in the office. So if you come into your derm appointment with a freshly washed face, then that'll help us with our assessments so that we can accurately diagnose what's going on in the skin, how things might be changing, and also what we can do aesthetically to help with your concerns. Now, along the same lines of having makeup on, you also want to make sure that you don't have nail polish on, especially if you're coming in for a skin check, because sometimes moles can be under the nail bed, and this is a place that we do not forget about when we're doing our skin check. So it's important that you come in with clean nails and that we're really able to evaluate what's going on under the nail bed. Now, so long as we're talking about how to present yourself and what to do in terms of prep for your body, the things that we don't care about is if you shaved or not. So often we hear patients apologize for not shaving. It really doesn't matter. We don't care. We see skin all the time from head to toe. And so shaving or not shaving is really not a concern. Be prepared to undress fully into a gown. So when you come in, if we're doing a skin check, we do put you in a gown. And so make sure you have the appropriate undergarments on, especially if you are bashful. But it's our job as dermatologists to look at all skin, no matter where it's located, so that you get the best exam possible. The third thing that you can really do to help with your dermatology visit is bring in a list of products and medications that you're taking. So the products might be tricky because you might have a ton laid out on your bathroom counter. So you can either bring in a list or take photos of them, but at least give us a sense of what you're using on your skin, what the ingredients are, and the steps that you're taking to use these products. It's our job as dermatologists to guide you through your skincare routine and to optimize the ingredients so that you're using the ingredients that are right for your individual skin type. I personally don't mind if you bring in the products in a bag or in your purse, because often I like to read the ingredients together with you and go through the steps at which you're using the products. Now, sometimes all the ingredients aren't actually listed on the product or on the box. So it's important to look at the bottle and see, are the ingredients listed or were they on the box? Maybe you threw it out a month ago. That's okay. We can still look it up, but not all the ingredients are going to be listed on the product itself. Medications can contribute to the frequency with which you're getting acne breakouts. Pigmentation on the skin can increase your risk of being sensitive to the sun, or we call that photosensitivity. So it's really important to have an up-to-date list of all the medications that you're taking. Now, if you're in the office and you're considering filler, you come in for a consultation, it's important that if you're going to get filler that you don't have a dental appointment within the next 2 weeks. And that's because dental appointments post-filler can increase your risk of infection, especially for placing filler around the mouth or mid-face area. So if you come into the appointment for a consultation and hope to be getting filler that day, just make sure you check to see all your dental appointments are at least 2 weeks after that appointment. And number 5, if you're coming in for a hair loss appointment, you've been noticing your hair shedding or thinning and you really want to delve deeper into why this might be happening, it is so important to come in with a clean scalp. So this means that there are no weaves or braids or product or topical cover-up or anything on the scalp so that we can accurately diagnose your condition and perhaps do a biopsy if need be. But it is so hard if patients come in with extensions or any sort of hairstyle that doesn't allow us to completely evaluate the scalp. We're really not able to get a true assessment in this case. And so if you have a dermatologist appointment, you've probably had enough lead time to plan for that. So I would recommend saving your hairstyling visit until after the derm appointment. The other thing to keep in mind is your hair color. So if you're somebody who goes to the salon every 6 weeks to cover up grays, then our examination and photos of how your hair is progressing over time are going to be skewed based on the color differences. So just something to think about when you come in now that might be a little bit stressful or not always time up with your hairdresser or your at-home dyeing or your at-home hair care practices. But if you could maintain a consistent color in between visits, then we can really monitor how your hair's been doing and we can follow it over time. Now, just as a side note, it is so important if you've never seen a dermatologist, it is so important to make your first visit, especially if you're in your 4th decade or in your 40s. This is the time that you need to schedule your first full body skin check. We think about scheduling skin checks when you schedule the rest of your normal cancer screening visits like mammograms, prostate checks, colonoscopies, and so make sure you loop in your skin check into that schedule. If you found this video helpful or if you learned something new today, make sure you like, subscribe, and share with a friend or family member. A new video drops every Sunday, so make sure you stay tuned for more dermatologist-approved skincare tips. Thanks for watching.